I would like to thank Ain Shams, of course, University for giving me this opportunity, and of course, my great professor, Dr. Mustafa, for giving me this opportunity to share in this paper and to share today with you our experience. I'm gonna here discuss now the results and the discussion regarding our paper, and as Dr. Dua gave us an idea about what we did. Actually, the participants that fulfilled the survey was 108. Their age ranged from 19 to 75. And as we can see that most of them were less than 35 years old. And they were females, most of them, around 67%, mostly married. And they were around 38.9% who were in direct contact with COVID-19 patients, while 61% were not. And this is our two groups that we're gonna do the study on or compare the results upon. At that time of the first wave, only 9.3% were infected with COVID-19 from our participants. We compared patients who were directly in contact with COVID-19 patients and versus who were not. As we can see, as I told you before, that group 1 were 38.9% of the participants, while group 2 was 61.1%. We used the Beck Depression Inventory. There was no significant difference between the groups, although that the mean of Beck Depression Inventory was higher in the first group, especially in the subscore of self-criticalness. Regarding anxiety, also we did not find a mean statistical difference between both groups, although the first group had a higher mean score. Both groups suffered from mild anxiety and depression. We also used two other scales, the Brief Cope Questionnaire and the Quality of Life scale. The Brief Cope Questionnaire, there was no significant difference except in the coping style in group 2, which is trying to see it in a different light to make it seem more positive. While the Quality of Life scale, also we could not find a significant difference between both groups except in the score related to satisfaction with socializing with others. We also compared our results between female and male participants. As we can see that 50% of the males were in direct contact with COVID-19 patients, in contrast to 33.3% of the female participants. When comparing both the female and male participants regarding depressive and anxiety manifestations, there was no statistical significant difference. The female group showed more significantly higher mean subscores than male participants on the Brief Cope Questionnaire, revealing that females used more coping strategies. And regarding the quality of life, we could not find a significant difference between both. Discussion. As I said before, that most of our participants were under the age of 35 because most of them were residents, assistant lecturers, and lecturers. And of course, the number of infected healthcare workers infected with COVID-19 were higher among the first group as they were in direct contact with COVID-19 patients. Both groups had mild depression and anxiety as we expected, and consistent with other research done, especially in China. And of course, the possible causes of this, that the participants were for the first time was dealing with a pandemic, which is very infectious and rapidly spreading. The workload increased so much, and the actual cases actually was increasing in the first wave. So they had the concerns about their own safety and the safety of their loved ones. The mild degree of depression and anxiety in the current study may be related that most of the participants are not in direct management with COVID-19 infected patients. And most of them at that time were not even infected with COVID-19. Although there was no statistical significant difference between both groups on the total score of Beck Depressive Inventory and Anxiety Inventory. As I said before, the results showed higher mean total score of depression and anxiety among our first group. And as the first group are the frontline doctors and personnel, we can expect this because the level of stress and burden they were facing was so much. And the responsibility to it, the patients, and knowing that at that time there was no approved vaccine or medication that can improve their cases. The shortage in personnel protective equipment, the increased number of infected healthcare providers, and of course the fact that they were isolated at the hospital at that time for a very long time. As we can see, our study results were consistent with the results of another Arab study done in Oman regarding their participants, which were mostly females and young physicians, that showed that COVID-19 affected physicians' mental health. No statistically significant difference were found between both groups regarding the effect of COVID-19 on the quality of life and their coping strategies, except in the score related to satisfaction with socializing with others. Group 1 showed higher level of satisfaction with socialization, as they were directly in contact with the COVID-19 patients. And of course, as we said, and as Dr. said, social support is considered one of the protective factors and psychological resilience that we recommend. Women in our sample utilized significantly more emotional and instrumental support to cope with stress, as we can see in the brief cope questionnaire that they used more coping mechanisms like saying things to let their unpleasant feeling escape or trying to get help and advice from other people versus male participants. We consider this is the first study to be conducted in Kasr Al-Ainy Hospital to assess the severity of depression, anxiety, coping strategies, and quality of life among medical personnel during the COVID pandemic. We also consider one of the strengths of our study is the anonymity of the responders, allowed more participation among healthcare providers and made them see that they might be suffering from mental health problem and seek help. And as we said, this was through an online survey, and which had to be done this way to keep social distancing during the pandemic. Of course, if we use clinical interviews in the future, it will give a more comprehensive psychiatric assessment of the participants. Further studies with a larger randomized sample would help us to give more precise data representing healthcare providers. Finally, our conclusion that there is higher prevalence of psychiatric symptoms among healthcare providers in Kasr Al-Ainy Hospital during COVID-19 outbreak. Medical healthcare providers, of course, are in need of adequate rest and recovery programs aimed at increasing their psychological resilience and well-being. We recommend special interventions to promote their well-being in healthcare providers during the COVID-19 pandemic. Thank you so much.